1. A pharmacy technician educator wants to assess understanding of HIPAA regulations among adult learners. Which assessment method is most appropriate for aligning with adult learning principles? A. Timed multiple choice exam. B. Interactive group case analysis. C. Memorization-based flashcard quiz. D. Pop quiz at the end of each session. 2. According to FDA regulations, which of the following must be included when instructing learners about labeling of repackaged medications? A. Expiration date and manufacturer's phone number. B. Beyond use date and lot number. C. Lot number and temperature range. D. Manufacturer name and packaging color. 3. During a mentoring session, a pharmacy technician asks about DA Form 222. What is the mentor's best instructional response? A. Review DA policy without practical examples. B. Demonstrate how to fill out the form using a scenario. C. Refer them to the state board website only. D. Give them a quiz without prior explanation. 4. When developing curriculum on hazardous drug handling, which method enhances adult learning and safety compliance? A. Weekly essay assignments. B. Online module without interaction. C. Live simulations with protective equipment. D. Open book exam only. 5. A technician in training must understand the federal schedule system for controlled substances. What evaluation method best supports knowledge retention? A. Fill in the blank worksheet. B. Watching a video lecture. C. Matching activity using drug cards. D. Reading textbook chapters. 6. Which technique would most effectively teach pharmacy technicians how to comply with OSHA's hazard communication standard? A. Requiring silent reading of the OSHA manual. B. Guided discovery through mock inspections. C. Showing a slide deck and asking for questions. D. Assigning individual reading logs. 7. The most effective communication strategy for teaching a diverse group of adult learners about state-specific pharmacy regulations is: A. Mandating textbook memorization. B. Allowing open discussion with role play. C. Using one-way lectures exclusively. D. Enforcing standard PowerPoint presentations. 8. A curriculum module on controlled substances must include which of the following to align with DA compliance? A. Federal taxation details. B. Label color schemes. C. Record keeping for at least 2 years. D. Technician salary requirements. 9. Which feedback method best supports adult learners in mastering proper disposal of Schedule II medications? A. Periodic review sheets. B. Written correction of quiz errors only. C. Peer-led demonstrations with debrief. D. Delayed feedback via email. 10. Which method of evaluation would best ensure pharmacy technician trainees understand how to identify forged prescriptions? A. Standardized patient scenario. B. Multiple choice test. C. Oral quiz. D. Essay on legal issues. 11. Which is a primary focus when mentoring pharmacy technicians on patient safety standards? A. Business continuity. B. Compliance with labeling and storage. C. Selling over-the-counter products. D. Upselling insurance plans. 12. To improve compliance with the Poison Prevention Packaging Act, which instructional strategy is most effective? A. Viewing slides on pediatric poisoning rates. B. Hands-on packaging and unpackaging tasks. C. Reading excerpts from the regulation. D. Role-playing customer service interactions. 13. What element is critical when designing a curriculum that covers prescription error reporting? A. Including complex case studies. B. Excluding legal terminology. C. Avoiding peer collaboration. D. Using memorization techniques only. 14. What is a required component in teaching pharmacy technicians about the Drug Supply Chain Security Act DSCSA? A. Brand comparison worksheets. B. Prescription pad recycling methods. C. Serialization and transaction documentation. D. Independent compounding procedures. 15. To ensure adult learners internalize the concept of REMS risk evaluation and mitigation strategies, which approach is best? A. Self-assigned reading and summary. B. Role play with patient counseling. C. Pop quiz on acronym meanings. D. Memorization chart. 16. In clinical instruction, how should a facilitator best communicate about the reporting protocol for adverse drug reactions? A. Share anonymous case examples. B. Emphasize punishment for noncompliance. C. Limit discussion to black box warnings. D. Provide only written policies. 17. During a training session, which strategy would best reinforce FDA labeling regulations? A. Asking participants to create a compliant label. B. Giving a pre-printed answer sheet. C. Reviewing outdated drug labels. D. Posting rules on the wall. 18. In teaching safety protocols for cytotoxic agents, which mentoring method is most effective? A. Observational checklists. B. Reading safety data sheets aloud. C. Providing a weekly safety email. D. Conducting online quizzes only. 19. Which instructional format is most likely to improve understanding of the Controlled Substances Act among adult learners? A. Reading summaries from a textbook. B. Watching a narrated slideshow. C. Participating in compliance simulations. D. Memorizing federal code citations. 20. What is the most effective way to ensure compliance training remains aligned with new pharmacy regulations? A. Updating the manual annually. B. Sending regulatory updates via email. C. Embedding real-time case reviews in curriculum. D. Posting memos on bulletin boards. 21. Which evaluation tool is best for measuring pharmacy technician comprehension of DEA number validation? A. Multiple choice quiz. B. DEA number matching activity. C. Lecture recap quiz. D. Peer evaluation form. 22. What communication approach supports technician understanding of FDA drug recall classifications? A. Distributing recall notices. B. Hosting roundtable discussions. C. Posting notices in break rooms. D. Showing passive video loops. 23. A preceptor models safe medication storage practices. This instructional method demonstrates A. Kinesthetic evaluation. B. Passive observation. C. Experiential mentoring. D. Formative assessment. 24. Which adult learning principle is best applied in teaching state-specific controlled substance laws? A. Authority dependence. B. Immediate relevance. C. Passive reception. D. Long-term deferral. 25. Which format best assesses competency in identifying high-alert medications? A. Long answer essay. B. Label matching game. C. Hazardous drug recognition drill. D. True-false worksheet. 26. A student questions the legality of filling an out-of-state prescription for a controlled substance. The mentor should A. Refer them to a pharmacist without discussion. B. Review state board regulations together. C. Dismiss the issue as rare. D. Assign independent research only. 27. To reinforce FDA guidelines on patient medication guides, instructors should A. Present real patient scenarios requiring guides. B. Rely solely on slide content. C. Assign passive textbook reading. D. Use open-ended surveys. 28. What instructional approach most supports curriculum alignment with USP less than 800 standards? A. Interactive PPE practice sessions. B. Mandatory daily quizzes. C. Pharmacy layout design assignment. D. Peer-reviewed posters. 29. A pharmacy educator should use which assessment strategy when evaluating technician understanding of HIPAA breaches? A. Written policy recitation. B. Hypothetical violation analysis. C. Multiple choice self-check. D. Role play of administrative procedures. 30. For teaching the legal implications of technician errors, the most effective communication method is A. Peer-led discussion of legal cases. B. Memorization drills. C. Legal code memorization. D. Weekly newsletters. 31. Which mentoring activity builds safety habits and labeling compounded products? A. Labeling contest. B. Observation and correction during tasks. C. Self-checklist review. D. Video-only demonstration. 32. What instructional element is essential for curriculum development on the OBRA 90 mandate? A. Emphasis on patient profile documentation. B. Lab report interpretation. C. Basic chemical compounding. D. Technician certification history. 33. Which instructional strategy ensures proper technician understanding of the Combat Methamphetamine Epidemic Act? A. Scenario-based register practice. B. Verbal quiz at end of module. C. Emailing DA limits. D. Watching a TV documentary. 34. For regulatory compliance instruction, which evaluation method offers the most insight? A. Pop quiz scores. B. Observation of workflow compliance. C. Student satisfaction surveys. D. Midterm reflection essay. 35. Which teaching strategy is most aligned with adult learning principles in pharmacy safety training? A. Allowing peer coaching and discussion. B. Using timed silent reading sessions. C. Mandating video lectures. D. Providing closed-book tests only. 36. What communication strategy builds retention in pharmacy regulation updates? A. Group discussion forums. B. Textbook-only learning. C. One-way memos. D. Weekly reading quizzes. 37. A technician asks about differences in federal versus state law on controlled refills. The mentor should A. Ask them to look it up later. B. Compare examples interactively. C. Refer them to the DEA manual. D. Ignore the question. 38. Which evaluation tool best measures real-world safety compliance among pharmacy tech students? A. Mock audits. B. Weekly spelling tests. C. Roll recall exams. D. Memorization drills. 39. In developing curriculum about immunization protocols, which adult learning strategy is most applicable? A. Practicing vaccine prep and documentation. B. Reading aloud from the CDC site. C. Reviewing historical vaccine data. D. Mandatory chapter tests. 40. What instructional component should be emphasized when teaching about the FDA MedWatch program? A. Reporting forms and procedures. B. Pharmaceutical patent timelines. C. Drug pricing models. D. Commercial marketing rules. 41. In clinical instruction, which method best ensures technicians understand pharmacy security protocols? A. Reading policy documents independently. B. Conducting walkthroughs with risk assessments. C. Watching recorded security footage. D. Memorizing alarm codes. 42. When designing an evaluation tool for regulatory compliance, which principle should guide question development? A. Relevance to real-world scenarios. B. Emphasis on rote memorization. C. Elimination of open-ended questions. D. Focus on historical case law only. 43. What mentoring method most effectively reinforces the importance of reporting medication errors? A. Supervisor-led incident debriefs. B. Written policy summaries. C. Passive email notices. D. Assigning research projects. 44. What is a key instructional component for teaching about state board pharmacy inspections? A. Overview of audit triggers. B. Review of pricing practices. C. Tour of non-pharmacy facilities. D. Study of insurance policies. 45. Which approach best supports adult learning during DA Form 41 training? A. Demonstrating destruction procedures in lab. B. Listing destruction guidelines. C. Assigning book chapter summaries. D. Showing generic training video. 46. Which instructional method builds effective communication for controlled substance inventory checks? A. Peer-reviewed accuracy drills. B. Silent observation only. C. Closed note written test. D. Weekly vocabulary quiz. 47. For technician development, which mentoring activity reinforces ethical decision-making? A. Discussing gray area dilemmas in teams. B. Assigning quiet reflection logs. C. Reading legal codes. D. Avoiding controversial topics. 48. What communication strategy best supports adult learners' understanding of prescription drug monitoring programs (PDMPs)? A. System navigation simulations. B. Scripted lectures without interaction. C. Infographic-only presentations. D. Weekly multiple-choice quiz. 49. When teaching technicians about HIPAA-compliant communication, which instructional technique is most effective? A. Role-playing patient calls. B. Distributing a one-page summary. C. Reviewing disciplinary cases. D. Showing silent video examples. 50. What instructional component is essential when covering technician limitations under federal law? A. Clear scope of practice boundaries. B. Pharmacology background. C. State tax code. D. Manufacturer marketing policies. 51. A technician educator is designing a module on the Ryan Haight Online Pharmacy Consumer Protection Act. What must be included? A. Criteria for legitimate online pharmacies. B. Steps in drug manufacturing. C. OTC advertising rules. D. Non-therapeutic supplement promotion. 52. When evaluating a technician's ability to apply infection control standards, the best strategy is A. On-site procedural assessment. B. Short essay exam. C. Closed book law test. D. Daily vocabulary test. 53. Which method of feedback supports reflective learning in legal compliance scenarios? A. Peer discussion with debrief. B. Anonymous grading. C. Yes/no checklists. D. Silent video watching. 54. When developing safety training around look-alike sound-alike medications, instructors should A. Use real-world label comparison drills. B. Post a list in the break room. C. Assign reading only. D. Distribute flashcards. 55. Which method ensures technicians internalize legal requirements for emergency refills? A. Scenario-based exercises. B. Memorization of quantities. C. Reading the Board of Pharmacy Manual. D. Watching corporate compliance webinars. 56. To build adult learners' confidence in handling DA audits, instructors should A. Conduct mock audits and simulations. B. Provide written lists of violations. C. Assign self-guided readings. D. Show outdated audit videos. 57. What instructional strategy enhances long-term retention of pharmacy law content? A. Case-based learning with consequences. B. Single-session lectures. C. Frequent true-false tests. D. Handout distribution only. 58. Which mentoring behavior most effectively promotes technician growth and regulatory awareness? A. Encouraging daily compliance reviews. B. Letting errors correct themselves. C. Avoiding sensitive topics. D. Ignoring difficult questions. 59. When creating curriculum for patient privacy standards, educators should prioritize A. Simulated real-life data breaches. B. Memorization of policy dates. C. Passive document sharing. D. Assigning research papers. 60. For pharmacy technicians working in telehealth, which regulatory topic must be emphasized? A. HIPAA compliance in virtual communication. B. Medication flavoring preferences. C. Warehouse layout. D. Reimbursement for over-the-counter items. 61. When assessing understanding of federal drug scheduling, which method is best? A. Interactive sorting activity. B. Writing drug definitions. C. Watching FDA clips. D. Weekly spelling tests. 62. Which instructional format most directly supports adult learners' ability to comply with labeling requirements? A. Designing mock drug labels. B. Taking vocabulary tests. C. Reading regulations aloud. D. Watching slide presentations. 63. What strategy ensures effective communication of legal obligations for tech-administered vaccinations where permitted? A. Reviewing scope laws in discussion groups. B. Posting notes on the wall. C. Reading assignment only. D. Asking for weekly journal entries. 64. When introducing the FDA Orange Book to learners, the most effective teaching tool is A. Interactive search demonstrations. B. Flashcard memorization. C. Reading index aloud. D. Assigning written summaries. 65. Which mentoring action reinforces accountability in technician record keeping? A. Auditing daily logs with feedback. B. Assigning group posters. C. Reading DA policy excerpts. D. Weekly self-assessment. 66. A technician educator wants to support retention of storage temperature regulations. What should they do? A. Incorporate digital thermometer simulations. B. Assign textbook chapters only. C. Read guidelines aloud. D. Provide weekly quizzes only. 67. Which instructional method ensures learners understand FDA drug classification and approval processes? A. Case studies with drug launch timelines. B. Matching drug names to manufacturers. C. Posting charts on classroom walls. D. Giving crossword puzzles. PTCB Pharmacy Law, Regulations, and Safety Test. The PTCB Pharmacy Law, Regulations, and Safety Test is designed to assess a pharmacy technician's knowledge of legal and regulatory standards, as well as safety protocols essential to pharmacy practice. This exam evaluates a candidate's understanding of federal pharmacy laws, controlled substance schedules, record-keeping requirements, and the roles and responsibilities of pharmacy personnel under state and federal guidelines. Emphasis is placed on compliance with HIPAA, OSHA standards, DA regulations, and safe medication handling procedures. Candidates are tested on their ability to recognize legal limitations of practice, ensure patient confidentiality, and apply safety strategies to prevent medication errors. The test ensures that pharmacy technicians are prepared to uphold public health and safety through ethical and lawful practice. Here are the top 5 beneficial uses of the sample exam. 1. Ensures regulatory compliance. The test validates a pharmacy technician's understanding of critical federal and state laws, ensuring pharmacies operate within legal boundaries. 2. Promotes patient safety. By assessing knowledge of safety protocols and medication error prevention, the test helps reduce risks to patient health and supports the delivery of safe pharmaceutical care. 3. Supports professional accountability. Technicians gain clarity on their legal and ethical responsibilities, reinforcing proper documentation, controlled substance handling, and adherence to HIPAA and OSHA standards. 4. Enhances workforce readiness. Passing the test signals to employers that a technician is knowledgeable and job-ready, improving employability and performance. 5. Fosters continuing education. The test encourages ongoing learning and professional development, aligning with evolving legal requirements and best practices in pharmacy operations.